Hi, I'm Nurse Shayna, and I'm going to show you how to use bottled insulin for diabetes. Okay, so first you want to wash your hands. Insulin that's not open is good in the refrigerator until the expiration date. Always remember, when you open your insulin, write your date on your bottle so you'll know when the date that you open it. Open insulin is good for 28 days after the open date, but always check with your pharmacy. Depending on your insulin, that could vary, but most insulin is good for 28 days after you open it. Okay, so first, wash your hands. Always perform hand hygiene. Then you want to, if your insulin is new, you want to remove the plastic cap. This insulin here has already been opened. So I'm going to take my alcohol swab and I'm going to clean the top of the valve. And I would disregard. Then you want to open your insulin needle. So always remove the top cap and the bottom cap of your insulin needle. Always remember, do not touch the needle. Next, you want to pull back on your syringe to the amount that you will be administering. Next, you want to take your vial and you want to insert the needle straight down. Inject the air. Then you want to flip your valve over while the needle's still inserted, and you just want to pull back on your syringe to the amount of insulin that you have. If you have any bubbles in your syringe, you can lightly tap it, and if needed, you can always push the bubbles out and then pull back to your desired amount. Always check your dose. Make sure that you drew up the correct dose. And if you have someone else around, if you're a nurse, you always want to get a second nurse or clinical staff to check your dose. But if you're at home, always double check your dose. And if you have someone else to double check it, that will be great. Insulin can be given in different sites. You have your abdomen, your back of your arms, your outer thighs, your upper buttocks. But you want to always rotate your site when giving insulin to prevent bruising. When administering your insulin, you want to clean the site first. I don't have nowhere to show you, but clean the site. Rather you're doing your abdomen, you want to clean the site. For demonstration purposes, I'm going to keep the top on the needle. And you want to take the area that you're going to inject. You're going to go straight in with the needle. You're going to inject the plunger. Let go of the skin. Then pull out the needle. Never recap your needles. You want to dispose of your needles into a sharps container or a plastic bottle if you're doing it at home. That way you're able to cap it off to prevent a needle stick. So I'm Nurse Sheena, and that is how you draw up your insulin, your bottled insulin, and administer it sub-Q.